Mitral regurgitation is when there is a backward flow of blood on the left side of your heart. The first sign of mitral regurgitation may be a murmur that was detected on a physical exam by your physician. And it's only really when you develop symptoms that you'll need treatment. The most common symptoms of mitral regurgitation are fatigue, shortness of breath, especially with exertion, as well as swelling in your feet, hands, or your abdomen, where your shoes are too tight, your belt and pants are too tight, or your hands and fingers are tight. And typically patients can have a cough. If you or a loved one have been diagnosed with mitral regurgitation, more than likely you'll be put on medications to manage your symptoms. But in the long run, you'll need a further intervention, whether it's heart surgery or a less invasive procedure like the MitraClip.